from my perspective, it really allows me to focus in on the clinical and medical needs of the patient. And by doing that also frees up space in my panel to provide care to more patients. So I think that's very helpful.
Yeah, I agree. As a social worker, I can meet with patients before and after the medical appointments and address issues going on in the background that might be affecting their treatment plan. This social work role is located primarily in the physicians' clinics, and we also go out and work in the band health clinics. And we take referrals from the nurse practitioners, physicians, and the nurses that work in the band health centers. And we can be a one-stop shop for all the social services in the community, so we can do an assessment and then refer on to the appropriate service without the physician or the nurse practitioners having to remember every service that's available in the community.
The big part about that is that the social worker becomes part of the team, and the collaboration that exists between the social worker, the chronic disease management nurse, and the physician really encompasses the whole patient as a whole, makes them feel that they have a team around them and that they're part of that team, that the patient then feels part of that team. And it improves their clinical and sort of health outcomes if we work as that team.
And I think because we can spend, we have flexibility in our role to spend a lot of time with patients, and we can intervene once or we can intervene many times over the course of that patient's life without having to be re-referred or go through another intake or waitlist process.
The successes we've had is having good outcomes for our patients, and what ends up happening is I make Tara more busy because you know, the social worker does such a good job, and we have such great outcomes that we tend to use them more and more and more, which is great for the patients. It's great for us. I mean, it's helps us efficiently use our time for what we're good at, and the social workers then use their time for what they're good at, and the patients feel that they're being listened to and heard. We had a patient who had recently had a stroke and stopped taking his medications because he had felt that he couldn't afford the medication. I referred the patient to Tara. Tara got in touch with the patient. We managed to link in the chronic disease management nurse, and through supporting the patient, managed to come up with a medication plan that was affordable for the patient. We're able to track down funding. Tara was able to find some funding for him to bridge him over until he reached a better financial situation. And the good news is that this week he picked up his prescriptions and paid for them and is taking his medication again. So it's a huge success story, and we continue to build on that. So.
If a patient has to go, especially from this region, go to Kelowna, go to Vancouver, go to Calgary, and they're not able to afford to go, that's where the social worker can come in and look at transportation options and funding. I think the easiest way to communicate with a social worker is through the EMR. So at the Kimberley Medical Clinic, the physicians send me tasks, and then I follow up with a meeting with the patient, and I can chart right in the medical file, and I can also have access to everything I need in order to do an assessment for, say, a person's disability or to make any other referrals that I need. And we also communicate through that messaging system in a really quick, efficient way. I also really like being co-located in Kimberley. I think that's a really great benefit of being here, is that we can just stalk the hallway and talk to each other if we need to.
If there's been one positive of COVID for the Kimberley Clinic and Kimberley Health Centre, is that it's created space because we don't have people that need to be here all the time. We can work from home, and when we are here, it's created space in the clinic for the social worker to be able to see patients and be able to be in contact with the physicians that are here, which has been really, really beneficial. It might help here just kind of background about how the social work this initiative started. Initially, it was an initiative that was started sort of tripartite through the Ktunaxa Nation, the East Kootenay Division of Family Practice, and Interior Health. It is funded through the Tanaha with funding that has been secured through the Primary Care Network, which is a provincial initiative now that is to try and improve team-based care and primary care for all British Columbia residents. Through this collaboration with the Tanaha Nation, East Kingston Division of Family Practice, and the Interior Health, accessing the social workers become a lot easier because we have more of them. There's funding that's available. We have more of them. It used to be, a couple of social workers. Now we have a few that are available, which has really made ease of access to them a lot easier, and they have designated clinics that they work with. So in terms of getting in touch and accessing them, here in Kimberley, we use the EMR. It's if we feel a patient really needs to see the social worker, we send them a quick task or an instant message and say, hey Tara, we need you to see this person for this and this reason, and she jumps right in and is able to see them right away.